So when you hear things like shortness of breath, fatigue, chest pain, and you know that they are symptoms of a heart attack, but it could also represent something else with your heart that can be fixed with an outpatient procedure. Now, joining us to share more about this are Dr. Delair Gardi and Dr. Carlos Oviedo. Thank you so much for being with us.
Thank you for having us.
And they're with our sponsor, Heart and Vascular Consultants. Okay, doctors, it's always serious when you guys are here. But talk to us about these symptoms. What are they signs of?
Well, this problem that we want to talk today is called aortic stenosis. It's basically we have in the heart a major valve that communicates the heart with the rest of the body. And sometimes when this valve becomes a little stiffer, the blood cannot come out properly from the heart and distribute to the rest of the body. So people can have a shortness of breath, they can feel dizzy, sometimes they can feel lightheadedness. There's also some people that can have some chest pain or chest discomfort, feeling the heart is running a little fast.
Okay, so what is aortic valve stenosis?
It's such a stiffening of these leaflets. There's leaflets in here, they should be very pliable, open and closing well. Some of the patients with time, with age, they'll be stiffened because they are either calcified or have some bacterial infection to it, or could be congenital. And this is restrict the movement of the valve. So guess what? The blood coming out of the heart has to go through a small little bitty hole. So the patients suffer to work, suffer to do any type of activity. This is when they'll feel it.
Okay, so how do you fix this condition?
Sure, fixing it, there's two ways. The good news, we have the new technologies right now. In the old days, it was a major procedure. It was the patient goes to the hospital, they have their chest open, and then either we put a mechanical valve or a tissue valve. The good news nowadays, it's not like this. We go through the groin, we can bring a big valve, which is right here, place on a stent. And the nice thing, once this goes in through the groin across, we'll place it in the aortic valve area. We open it like a stent, and within a minute, the valve is working.
That's incredible. Now, you mentioned that this is an outpatient procedure. What is the recovery like?
That's actually completely right. As you may know, and the people may know, before this disease was only treated with open heart surgery, recovering 5 to 6, sometimes more days stay in the hospital. With this simple procedure these days, you come to the hospital as an outpatient. The procedure is done in 2 or 3 hours. You stay in the hospital overnight. Next day, if you are feeling all right, drinking, eating, walking around, we check your blood pressure, make sure you're feeling all right, and you can go home.
That's incredible. That is absolutely incredible. Now, Dr. Gardi, this is something that you are very passionate about because a family member of yours had this condition. Tell us about that.
Correct. It's my own beloved mother. More than 10 years ago, actually, she had severe aortic valve stenosis, and she's back and forth in the hospital, almost lost her. This valve, we placed it for her, and guess what? In the morning, she was brand new, just like nothing happened, and she lived 15 years happily after with this valve clicking.
That's amazing. That's amazing. Now, Dr. Oviedo, you are from Paraguay and you are fluent in Spanish. You have a message for people who may need help, but there might be a language barrier there. What do you have to say?
That's right. In addition to English and some other languages that we speak in our clinic, our team also now have full staff speaking in Spanish. And quiero comunicarle a toda la comunidad latina que no se preocupen. Si tienen alguna pregunta sobre presión arterial o enfermedades del corazón, todos son bienvenidos aquí en Detroit y tenemos otra clínica en Livonia y los esperamos con los brazos abiertos.
Wonderful. Dr. Gardi and Dr. Carlos, thank you both so much for being with us and sharing this very important information. Great to see you as well.
We got used to coming here.
Yes, thank you. Thank you.
Happy holidays for everybody.
Same to you.
And happy Thanksgiving. Thank you for having us, as usual.
Thank you for being here. It's incredible information.
Oh, thank
so
you.
important.
Always.
Thank you. To find out more about all that Heart and Vascular Consultants can do to help you have a healthy heart, visit their website, hvchealth.com. Again, that's hvchealth.com. Or call the number on your screen, 313-832-8888. That's 313-832-8888. And we will be right back.